What is the likelihood of experiencing nerve damage after the removal of wisdom teeth? What are its consequences?
So what this follower is asking is, what is the likelihood of damage to the nerve after the wisdom tooth, and what are the consequences? So the chances of you incurring any type of nerve damage is anywhere up to 10% or maybe even slightly more, depending on the operator and the experience and your situation. So anytime, again, talk to your dentist or your surgeon or your periodontist to see what is your risk percentage, or whether you are a high risk patient or you're a low risk patient. That depends on how close the wisdom tooth is sitting to the nerve, what is your age, and whether you have any other type of medical complications. All of those things do matter. So I can't really tell you, like throw in a percentage and tell you what is the percentage. And then the second part of your question is, what are the consequences of having a nerve damage from the wisdom tooth? So there are two types of complication. Nerve damages can happen. One, you're going to lose sensation to the lip or the chin following the procedure, or the second, you may end up having loss of sensation to the tongue, whichever side you are going to have the tooth removed. For example, if you are going to have a tooth removed on the right side, you may lose a sensation to your tongue, half of your tongue, or half of your chin or the lip, or to the side where you're going to have the tooth removed from. A lot of times patients tend to think that they are going to lose function. So people, I always, or a lot of times patients here say, oh, is my half of my face going to be paralyzed from removing the wisdom tooth? No, because the what we call it as a motor nerve, the functional nerve, is not going to be affected most of the time, or any time at all, I would say, by removing a wisdom tooth. Only the sensations are going to be affected, which are going to be to your tongue or the chin or the lip. Again, talk to your dentist or the surgeon or your periodontist, and they should be able to tell you what kind of a risk you may face, or what may be the consequences.
That can be scary.
It could be scary, but it is a lot of times it is treatable. And again, I've been practicing for the last about 30 years, and I've had quite a few instances. Patients had some type of nerve damage, and a lot of times, we see them recover like all the time. If the numbness comes back, and very rare occasions, and we know that we explain to the patient they are going to have some kind of a nerve damage, and then if that happens, and then there are several means to handle that by sending them to like a neurophysician or a microneurosurgeon. And if you happen to be in the Dallas-Fort Worth area, come see us and we can definitely help you.